We often hear someone saying, I was at a wedding last night. The company was good. The food was good. I ate a lot. I think I binged. No, he did not binge. He overate. It was fun, but this is not binge. Hello? My name is Dr. Hany Bissada. I am an associate professor of psychiatry at the Ottawa Hospital and past director of the eating disorder program at the Ottawa Hospital. Today we are going to discuss binge eating disorder and the difference between binge eating and overeating. The big difference is pleasure versus no pleasure. When you enjoy food and you enjoy it with company, this is not binging. This is socializing. You may eat too much. You may say, I eat too much, but it is not binging. So what is binging then? Binging is a situation where someone has an urge, not a desire, an urge to eat huge amount of food quickly within an hour or 2 hours. It is not fun. The person, once finished the binge, feels distressed, feels disgusted with himself or herself, and feel guilty. That's why they always do it privately, in secret. They don't do it in front of other people because they are ashamed. And this is a difference between people who overeat for fun and pleasure. The person who binged feels guilty, distressed, upset. Why does he do it? Usually it is a negative emotion, never a positive emotion. A negative emotion. Something bad happened or something bad happened in the past and keeps bothering the person. Traumatic events, physical abuse, sexual abuse. I give you just a very basic example. You go to your office in the morning looking forward to your work. You go in the desk, you have a pink slip, you are terminated. You are really shaken, upset. What can you do? Nothing. You have to leave and go home. You go home and you binge. Why are you binging? It's a way, not very healthy way, but it's a way to appease the hurt, to relieve the pain, the emotional pain. There are complications for binge eating. Not only the emotional part where you feel disgusted and upset and ashamed, you end up gaining weight, and you end up gaining weight quickly, which means you become obese. And you end up with the medical complications of obesity, such as diabetes, high blood pressure, heart attacks, etc., etc. About 20% of obese people may have a binge eating disorder. And usually it is more frequent in females than males, 3 to 1. There is treatment for binge eating disorder, and we have treatment either psychological or pharmacological or both. Psychological treatment is what we call cognitive behavioral therapy or CBT. The way it works, it will help the patient understand the emotional trigger for the binge eating. What happened in the past that upset you so much until now. It will help you also regulate your eating. In terms of pharmacological treatment, we have the medication called Vyvanse, which is known for the treatment of attention deficit disorder, but now Health Canada approved it for the treatment of binge eating disorder. It is what we call a psychostimulant, and it has to be taken early in the morning, otherwise it will affect your sleep at night. Binge eating disorder is a serious disorder. There is treatment for it. So if you or a loved one has a binge eating disorder, or you suspect they may have an eating disorder, a binge eating disorder, please encourage them to seek professional help. Thank you very much for watching.